Hello, Miss STNA. My name is Amy. I'm your certified nursing assistant today. I'm here to put a bedpan on you. Before I do anything, I'm just going to wash my hands, give you privacy by pulling the privacy curtain, and I'll go get my supplies. I'll be right back. So I'm back with my supplies. So I've got the bedpan, I've got the toilet paper, I've got my gloves. I always like to see my gloves because it's so easy to forget. I've got dry towels or washcloth. I've got this. So what I did was, I don't have water in the basin. I just have a rinse, washcloth, and a soapy one, okay? So this is one creative way that you can, because I'm not actually actively washing her, right? So this should pass. And of course, if I hadn't mentioned that, the barrier, okay? And then I've got my hamper and my trash can. So, because I do need you guys to be able to see how I place this, because this is important. This is some of the things, something they're gonna be looking at, okay? The thing about this scale, it's multi-stepped, and there's certain things you need to do, okay? Placing the bedpan, of course, you must wear gloves because we're dealing with body fluids, and then your recording, okay? Those are important. Okay, so I picked a side as usual, so I'm gonna pick this side. I'm picking this side, so this side is up, okay? So ma'am, I'm just gonna temporarily put this up. I'll be sure to put it down when I'm done. And then this is the side I'm gonna be working. So something that I know a lot of students struggle with is bedpan. A lot of people think this patient is dependent. This patient is not dependent. They just need you to put the bedpan on and step away. They do their business, and that's why you have the toilet paper. When you come back, you take the toilet paper from them, and all you need is to get the yarn, you know, the bedpan, and that's it. They don't need you helping them to wipe their business, okay? So for this, I need to raise it. You don't need to raise it, but I am going to because it's gonna help my back, because I want a good body posture, and it's good for her safety, okay? Anytime you walk around the bed, you really want to be raising the bed. So we're gonna raise this bed. Again, this is a live person. So what does that mean? It means that you can give instructions and they will follow. However, this is COVID era, where we're having to deal with mannequins. We have to be compliant with the social distancing. So I'm gonna have this patient now. I'm gonna tell her or him to please roll over on that side. Okay, and she's gonna do so. Cookie points. Bed, head is supported, patient on line on arm, patient can breathe. Okay, now I'm ready to do my skill. I'm gonna put my gloves on. The positioning of the bedpan is very important, okay? So this is how you do it. They're gonna watch you place the bedpan. And remember, it's a live person. So what I will do is tell this person to please roll back on their back and adjust themselves, because they can, okay? So but then it's a mannequin, so I'm gonna have to work this. You come in, you're comfortable, can you adjust yourself? She says yes. I'm gonna give her the toilet paper. Remember, she can clean herself. So this in itself should be an indicator that they're not dependent on you, okay? They can wipe themselves. So this is it. And no one pees laying down. Make sure you raise the head of the bed. And while I'm doing that, I'm also going to take the bed down. go, she's sitting up. I'm gonna quickly go unrestrain her. I have to give her privacy, so I'm gonna step behind the curtain. So that's like stepping out of the room. Okay, coming back with clean gloves. And you're done, ma'am? She said she's done. Okay, so I'm gonna quickly, because I'm gonna raise the bed. Again, it's all about her safety and my protection. What I need to do now, while she's here, before I raise the bed, is I'm gonna wash her hands while she's still seated up. So this is the soapy side. This is the rinse. And then I'm gonna pat dry. I'm patting dry because I'm the one doing the skill. She can wipe dry, okay? Okay, so this time, I'm gonna lay you flat, ma'am, if you don't mind, and then raise the bed. So ma'am, I'm gonna have you turn on your side so I can get the BedPan out. So she's gonna do so. Again, remember this is a live person. They will be able to turn. So once I get it out, I'm gonna wait for my test observer to pour urine. So you can come. Thank you. Okay. Yes. So she's poured the urine. Okay. So again, it's all about optics. Okay. It's all about optics. The most important part is what I teach my students. The most important thing is you do not want to have any accidents with this. Okay. So I'm going to speak to this situation here. This bed is high, side rail is up, and it just doesn't look safe. So I'm gonna go for extra points, okay, as opposed to finding a place to put this and then putting down the bed and all that. Now I'm just gonna stick it because I need to go measure this, okay? So at this time, the bed is low, the side rails are down, call light is within reach, my patient is safe. I'm gonna go record my urine, okay? Make sure when you're pouring the urine, not from the wide part, from the narrow part. So now we're going to record. So things you need to know. Proper body alignment is very important. You've got to do that, okay? You can't do this. You cannot do this. No, you're gonna go eye level. And read on the CC side, okay? These measurements are done in CC and ML. So I look, and you can turn it around, figure out, see it, and then make sure you put in the right thing. Make sure you sign and put your title. So at this time, I'm ready to clean up. Again, do not take for granted that this is the toilet. Ask your RN observer, Okay, now usually this will be dumped into a commode or a toilet. Where would you like me to dump this? And then they will signify where. And she says it's okay, so I go ahead and do that. And then I still need to clean up. And then return to the designated area. I'm back, and the first thing I want to do is immediately take this bed down. Situate my patient. Bed is down. Take my side rails down so I can go ahead and clean up my table. See, my table tells a story. It means I've still got things to clean up. So I'm just gonna go ahead and clean this. Remember, I gotta go wash, rinse it down, dry, and return it to the storage. So that's what I'm gonna go do. So I'm back cleaning my supplies. You still okay, ma'am? She says she's doing fine. Are you in pain? She denies pain. Bed is low. I'm ready to close. Keep my glasses. Okay. Give her the call light. Patient's posture is fine, aligned. Make sure bed is low. Patient is comfortable. Push back the curtain. Now I'm going to take my gloves off. My hands.